I'm Dustin Karras, co-founder of Pattern, and I'm joined today by Dr. Hardin, and she's our physician liaison here at Pattern. She's also the co-founder of Rethinking Residency. She's passionate about addressing mental health in the medical community, especially among residents and early career physicians, and she works to challenge the stigma that surrounds a lot of these issues. And she hosts the podcast Promising Young Surgeon, which also serves as a valuable resource for physicians navigating the challenges of residency and beyond. So I'm real excited to dive into this much needed conversation on mental health and the pressures facing physicians during training. So obviously mental health, it's a topic that's often swept under the rug in the medical field. So, residents are obviously under enormous pressure, personally, professionally, and that doesn't let up. So Dr. Hardin, from your experience and the conversations you've had with residents and early career physicians, why is it so critical that we address the mental health stigma specifically within this group?
Absolutely. Thank you so much for having me here today. It's always a pleasure to chat with you. You know, I do think that you've already touched on what's really important here, which is that for resident physicians specifically, early career physicians, fellows, even medical students, it's a very vulnerable time on a marathon journey that's really rife with its own sets of challenges and kind of precursors and risk factors for burnout, which we all know and we've been hearing a lot more about these past few years. Right. And another thing that's really important about this formative time is that, like you said, it doesn't magically let up. Mm-hmm. I can tell you, being an attending for several years now, your problems don't just automatically evaporate when you become an attending. There's not a magic switch that's flipped. So the importance of really learning tips and tools, figuring out who you really are, finding your own professional grounding early on in your career, it just sets you up for success. You'll still need to be able to access all of that for your entirety, of your practice. So in terms of why addressing the mental health stigma is a big deal at the med student, resident, fellow, early career physician level is because the stigma prevents people from getting care that they need, right? They worry so much that this will affect their own occupation DI. It will affect the professional opportunities available to them. It'll affect how people perceive them at work maybe. All of those types of things, fear of discrimination, they stop people from getting care that they need, which is, ultimately a big deal. What's encouraging is that not only anecdotally, but over these past few years, we've seen evidence that seeking care even makes people better physicians. It not only makes you a better person, but a better physician. So it is important to destigmatize.
Absolutely. Yeah, if you're well, then you can help others be well, right? So we know this sort of stigma doesn't just come out of nowhere, right? It's usually deep-seated in the culture or maybe the culture of the industry or even systemic. So what are some of the key factors that you see contributing to that stigma, in the medical community and specifically with residents and fellows?
Yep, exactly. Like you said, a lot of it's historical. It's generational. There's certainly an ethos passed down each generation within medicine, which is if I had to survive this, then you do too. And if I had to walk uphill both ways to the hospital and back, then you do too. Right. They certainly didn't provide, any counseling or assistance for us back in the day. Fortunately, I think that historical piece is changing. There's a culture shift that's occurring in and outside of medicine. It's 2024. Right. So fortunately, a lot of people are coming forward, sharing their stories. It's actually okay to ask for help, and it's not a sign of weakness to ask for help if you need it. The other big thing that I think is important about stigma that's often overlooked is this whole aspect of it that's kind of mysterious. And I care a lot about demystifying that, because what happens is that people think, okay, maybe I am having a hard time. Maybe, yes, I'm several years into training. I'm struggling currently. It's a challenging season of life. What would even happen if I asked for help? How could I get help? What would that look like? So who would I even go to? What kind of conversations will I have? Will people find out if I ask for help? There's so much mystery surrounding that, and that also keeps people from getting the help that they need. So I think that the more that we can kind of share each unique journey, the different options available to them, it's like your whole world kind of opens up.
Yeah, absolutely. Yeah, that makes a ton of sense. Yeah, obviously, we work with physicians at Pattern here, so we're seeing a large number of doctors each year, and it's at this very particular moment of their career. They're transitioning from their training program into their first attending role, and so there's a lot happening, and there's a lot of mental health challenges that can make it even harder. So, in your work with residents, how have you seen the mental health stigma influence burnout and their ability to make really good life decisions in that? It's a pretty critical period of time, that transition time right there.
Exactly. And it's a time where there's a confluence of all these different factors, including their physical wellness, their mental wellness, but also, of course, their financial wellness, right? And so I love the way that you phrase that because it really highlights how vulnerable this population is. They're about to come into some money, so people can feel tempted to prey on that. But what's important is that, certainly I'm a surgeon and physician, and I care a lot about the physician. It's like, is every resident well positioned to make the smartest choice for themselves, and their family? The answer may not be yes, because they may be in crippling debt. And so financially, they have to make the right financial decision, which may not align with all of their other needs. Or similarly, they may be coming out of training so burnt out and in such a difficult place that they aren't able to make that big picture right decision for themselves. Like they're looking for something else. They're just kind of reacting to and running from the burnout. So that leads to the decision rather than coming from a really healed place and being able to make the truly all around right decision for yourself and your family.
Right. Yeah.
Long term.
You can't expect to make good, clear decisions if what's going on in your brain is just a mess, right? Like if there's a lot of action going on and confusion and uncertainty and all those things, if those haven't been resolved, they hang out there and they confuse the decisions that need to be made. And we run into this frequently. This whole phrase has been coming out, decision fatigue. And so to your point, like doctors, like they get home from, a day at work and it's like, what do you want for dinner? Don't ask me that question, right? Like it's some simple things like that. And we're talking about like life critical decisions that are having to be made that are, exponentially more difficult to make.
Yeah, that's such a good example of it too. Cause like you say that and I'm like, yeah, that question has crippled me before. Yeah. Like it just, if you're already at a tough spot. And I do want to cite some of the data out there. Like when we talk about the resident physician workforce, okay, if they're coming out of training with burnout, that's the opposite of being set up for success, right? And it does play out during your attending life. And we see that in, for instance, one of the big AMA surveys a couple years ago between 2021 and 2022, when asked about the likelihood of leaving their current organization within 2 years, 40% of physicians said that they had moderate interest in leaving, were likely to do so, or definitely would do so. And we see these really high levels of interest in leaving the clinical workforce. Yeah. So that plays out even beyond the early years finishing training in early career physicians.
Yeah, that's a staggering statistic. I mean, it really is. So obviously this is a giant problem, right? And typically problems like this, you can't just flip a switch and everything has changed, right? It has to come from efforts from individual doctors, the hospital systems that a lot of these doctors are employed with. So what steps do you think that can be taken at the individual level, specifically for residents, and also maybe at the broader kind of systemic level, to start turning the tide of this mental health stigma that's out there?
At the individual level, I really encourage everyone to just take agency over their own life. It's so easy, especially as a student, a resident, a fellow, for your whole identity to be caught up in what you do as a physician or a surgeon. Of course, that's enormously important, but I do encourage people to look outside of that as well, because we are three-dimensional people, no matter how much like the grueling process, beats that out of us. And so at the individual level, and I share this kind of from experience, I guess that there's nothing wrong with sharing your own story. Somebody has to go first, you know, at your own institution or in your own department. There's nothing wrong with being that person. And talk about demystifying the process. It's very freeing to share your own experience, some of your own opinions on these matters, and to find that the world doesn't end, because then that makes you braver to share more. It also enables the people around you to feel like that they're safe to share with you. And so that's really important. I think that that's on the individual level, something huge we can do. Systematically, you know, a lot of cultures are top down. So the more that we put people in positions of power who believe in and encourage this kind of care, I think that that's huge. And then another major initiative going on nationally is removing intrusive questioning from licensing and credentialing, because that's another very real, that's not just a perceived, that's a very real roadblock in some careers.
I've heard that over and over again. They're not willing to go get the help they need or to say the things that they need to say because they're of that fear of what are the ramifications professionally for me and personally financially, right? If I make some of these claims and statements.
Fortunately, though, you know, many states have already removed that licensing questioning. And then also there's a lot of institutions who have done so as well.
Yeah, that's awesome. Cool. Well, so you've obviously personally taken some pretty big steps. You know, you have the Rethinking Residency website. You also have the Promising Young Surgeon podcast. You have some amazing platforms that are speaking into this issue. How would you say those have been able to help you communicate the message out more?
Yeah, they've allowed me to really examine my story and my journey honestly, which has been very freeing. And in kind of living a more authentic life, it has enabled others to also feel free to like look at themselves critically and be more authentic with it. I think that that's something that resonates with the next generation of students and physicians as well. Like maybe that's not something that people were looking for a couple decades ago, but I think it's very much what a lot of us want now, is not like things to be smoothed over or, you know, quote unquote, all aesthetic and nicely packaged up and professional. Like we want something real, and we want to see real people kind of overcome challenges. I think that what's cool about these platforms is that it isn't even about the person's specifics of their journey. Yeah. It really isn't about that. It's about the universal themes that we can all relate to and learn something about from that person sharing, what has come from their own experience.
Yeah, for sure. And I think, you know, there's empowerment in somebody being vulnerable, right? And so if you're willing to share your story and then you get a collection of these stories, it becomes more of the norm, right? And you're able to come together as a collective and communicate out a message, right? And so these platforms, I think, I've seen them enable you to bring more voices together and multiply your effect. So I think that's awesome.
And I think that this one quote really stood out to me. It's from Dr. Kirch from the AAMC. He's the president emeritus, but he said, "Stigma can cost lives, and sharing our personal struggles can help save them."
Yeah, hyper practical and like truly life and death in some situations, right? So amazing. So we've heard lots of stories of residents that are, you know, they feel isolated with burnout, you know, depressive thoughts, anxiety, those sorts of things. So do you have any practical advice to offer, you know, someone who's currently dealing with some of those specific challenges?
Yeah, you know, I do come from a place where I basically white-knuckled it for all of my training for like almost a decade, and I do not recommend that approach. You know, technically, I did it, and I'm here now, but at a pretty substantial cost, I would say, and, you know, that's not anything that I would want for the next generation. And so what comes from that, I think, going back to agency, is just that I really encourage people to critically look at what they want and need and to follow that. That may mean that you're the only person in your class or in your department doing one specific, you know, type of thing, but that's okay. You know, in medicine, we've been very encouraged to just go with the flow and fit in with the group. But, you know, there's nothing wrong with, I think, taking agency over your own life And so that's what I just encourage people to basically know that no one's coming to save you. And you may get through residency and fellowship and be an attending, but again, like, no one's going to come and save you. We have to kind of find purpose and find our own boundaries professionally and, otherwise for ourselves. No one can just give those to you.
Yeah, that's so good. I think that's really powerful. The whole idea of taking agency, and the reality and the truth is that other people are struggling in the exact same way that you are, and sometimes you may not, just like they may not see it in you, you may not see it in them, right? And so, taking that agency and taking steps that are proactive and addressing the issues, man, it's super powerful. So, thanks for sharing that.
And it's almost like the opposite is so depressing, which is this thought that there's like thousands of doctors out there who are all totally siloed and kind of suffering in silence, and they feel like it's just them.
Yeah. I don't know how we want to transition here. I know that, when it comes to disability insurance, I mean, that's where we live our lives, disability and life insurance. Obviously mental health is a big factor, contributing to how these policies get underwritten by insurance companies and all that. So, I would love to answer any questions you think doctors would have about how this impacts their ability to get different types of coverage, or how the insurance companies view this, and similar to the licensure issues that they're running into. I think there's a fear from, getting, am I going to get approved for coverage by the insurance company based on these things? So, what questions do you have for me?
Yes, exactly. And certainly, I want to come to the table, of course, as a practicing surgeon and basically get your expert opinion on some of these questions about insurance that I think a lot of us are thinking and, may not have opportunity to ask. And the reason why, I want to start off talking about the mental health exclusions is just because it's wild, but I know that that's one of the top two most common reasons for a physician to get an exclusion on their policy. So whether we like it or not, this is a big part of the conversation, and it's at the forefront of a lot of people's minds. So some people in medicine will basically caution us that if you seek any treatment or help for a mental health disorder, then we won't ever be able to get own occupation, DI or life insurance. So is there any truth to that?
Yeah, I mean, I'll start and kind of piggyback with where we just came from, which is, if there's a problem, if there's an issue or a challenge you're facing, like, there's nothing more important than taking care of yourself first, right? Like, you have to be well. And all these other things are secondary, because you got to be okay. Like, that's step number one. So I'll put that blanket statement out there. Don't wait. I've seen people, and I've gotten my own insurance, and for different reasons, I delayed getting insurance, and this is something I live with, and live for. And I've delayed for various reasons, and it's a bad idea. It truly is a bad idea to delay getting the help you need. And so, when it comes to the practical side of this, the answer is anything in your medical history is basically game for the insurance companies to review and use that as part of their assessment, their analysis on can they cover you as a risk, right? So one thing that is true, and a lot of times hard for doctors to understand, is the difference between their understanding about their condition or what they're struggling with versus what the insurance company is trying to look at, which they're looking at data, they're looking at statistical analysis and deciding, if this factor exists and this factor exists, what's the likelihood that this person will go on claim? It's not so much, is this person okay right now? Like, that's not the question they're trying to answer. And so...
Yes, and that's super helpful, just thinking about, and I like that you called it a game, because honestly, I think that a big takeaway is that we are playing two different games here.
Absolutely.
One game is that the physician shows up to work every day to assess patients, identify disease, and treat disease. Yeah. Whereas on the insurance side, I mean, they are numbers people, they are looking at risk, right, big picture. And it's funny because there's a little bit of overlap in the diseases that we maybe deal with, but right, in such different capacities.
Right. Yeah, exactly right. So on a really real level, like, there a lot of these mental health issues that are out there, depression, anxiety, ADHD. Those are some of the top ones that the insurance companies are evaluating. How do we think about these? And of course, all of those are on a spectrum, right? There's varying degrees of how critical those things are to somebody's life, and then obviously there's confounding factors and variables that go along with those too. But to be clear, like a lot of times these insurance carriers, they're looking for stability, right? So if you have a history of depression and you're on a medication, they want to know how stable is this condition. Like, have you had to have any treatment changes in the last 1 or 2 years? If you haven't, they're actually going to look at that relatively favorable. But if you just got on a medication for depression or something else, like that is different. They're going to sense that as different. So
like higher risk versus
higher
lower
risk, right?
Got
yeah.
it.
So risk being is equivalent to uncertainty to them, right? So if there's an uncertainty that exists, they're going to be a little more hesitant in saying we want to cover that particular risk, right?
Perfect. Well, that makes sense. And, part of my understanding is that in addition to stability, another major factor going into that calculation would be like recency as well.
For sure. Yeah.
Which makes sense. I mean, it does make logical sense to me on the physician side, although, like we're talking about, it is still so important to be like, we're still playing different games. You can't think of them as similar entities.
Right. Yeah, it's a great point. Timing is everything. And the other thing to think about too is, doctors are, they're trying to look at their entire situation, and literally the insurance company is looking at a specific point in time, trying to make an evaluation on future risk, right? So what do they have to go on? What they know right now. And so,
Exactly.
that's a piece of this. And so if you're feeling confident, you've been on a medication for 6 months, and you're confident this is going to, either resolve, within the next couple of years, or you're going to be able to maintain, like they don't know that. What they have is thousands and thousands of examples of certain scenarios playing out, and they have statistics,
of all the different trajectories, and they just get one cross section. That's a good point too, because definitely, I cannot relate to that as much. Like even in clinic, of course, we get to follow patients and we get to, reassess at multiple points, but it's like they up front get one really good shot at their calculation and kind of estimates. That's interesting. No, that's a helpful point. So, of course, at Pattern, you guys are a broker, and you have 5 different carriers. And so does your team of experts find that over the years and all the data, the great data that you guys have collected, that any specific carriers are more favorable towards covering physicians with a mental health history than others?
Yeah, it's a really, really good question, because the answer is yes. Like we work with thousands and thousands of doctors each year. And so the data set that we have, in our existence is pretty large. And so you can start to see trends. You can see how different carriers handle different issues, very specific issues. Like within the mental health category, you can see how different ones handle different issues. And it fluctuates over time. So you may have one insurance company that is favorable 3 years ago on a certain issue, and now they're becoming less favorable. And so with the amount of work that we do with doctors and the amount of doctors that we see go through our process, like we see the outcomes, we see how the insurance companies have responded to, certain levels of medication and certain diagnosis, and how long treatments have been going on. We see all the variables going into that, and we can make and help the doctor understand and make judgments about what's the best route to go here. And I think that's something that's, unique to us, because we do work with so many doctors. You can't make a lot of claims based on, 10 doctors that you work with. But when you get in the thousands, you can start to make some pretty wide sweeping statements and also communicate about trends that we're seeing.
Yeah.
For example, we have one carrier that, and a lot of this is because of the amount of volume that we end up presenting to them. They're realizing that ADHD, for example, is it's a very specific diagnosis that a lot of residents are getting in a very kind of situational moment of their life of residency, right? It's intense, and so the diagnosis exists for that period of time, and then after residency, treatment ends, and then you have a different type of situation. So the insurance companies aren't dumb, right? But it does take time and numbers to figure out what's really going on here. So they see a diagnosis like ADHD come on the forefront. and they're like, we're going to pay attention to this for a handful of years, and now we'll make a judgment. Well, they've made a judgment, this particular insurance company, and they're willing to, if somebody has a diagnosis of ADHD, exclude just the ADHD from coverage, right? They say they won't pay
rather
for
than
something,
all mental health,
rather than the whole slate, right? Instead of what's normal is a blanket statement that if any mental health issue comes up, you're not covered. That's like going nuclear, right?
Yeah.
And they're trying to pinpoint, to their credit, what the real issue is. And I would say the insurance companies are getting better. I would say there's a legitimate effort to cover risks more favorably, but I would say we're still in the beginning stages of that, right? And so we see some positive movement there. Same with clinical depression. We've seen movement there too. A lot of times the codes that come through for depression, sometimes they interchange major depressive disorder with depression.
Right.
And so they dig a little bit more, to their credit again, and figure out, what are we actually dealing with here? What's surrounding this diagnosis? What's the medication? Have there been events that have taken place that contribute to this or not? And they can start to be a little more favorable in how those outcomes turn out too. So I would say, we do have a unique ability to help doctors navigate kind of this landscape, and it's shifting over time. And the insurance companies, they're not trying to make people better. They're not in the business of health.
Right.
They're in the business of statistics. So and they're in business. They're trying to make money too. And I don't begrudge them for that. But sometimes the decisions that they make they're pushing to get a profit, right?
Well, it's really illuminating. I appreciate you kind of explaining that, delineating some of these more granular, specific diagnoses, not just the whole umbrella for mental health exclusions. What I think has been really helpful for me is that, as a doctor, especially when I'm looking at an industry outside of medicine, I want things to be black and white. I just want the facts to be facts. I'm good at learning facts. So when I come to you and I just say, hey, which carrier is the most favorable towards mental health history for physicians, I really can appreciate the nuance in the fact that there isn't just one permanent, clear, right answer, one obvious historical answer or one that will clearly permeate into the future. But the fact that you guys have this robust data set and can see some of these changes happening in real time, I do think that that's advantageous. I know that you guys currently do have a front runner in terms of who anecdotally, and again, you're already seeing signs that they are more favorable towards that. So that's great to know. I think that that's reassuring for somebody like me.
Sure.
But I just appreciate the explanation and the fact that it isn't well, that's too complicated. You can't know who's most favorable and no one knows.
Yeah.
Because it's we really do love to see the data and to just know about these trends and kind of speak plainly about them.
Yeah, to your point, doctors are brilliant, right? And so, when it comes to data, they get that stuff, right? You're reading articles all the time, you're reading studies and synthesizing that information. This is not complicated information, but we can communicate this to a doctor and they get it, right? And they understand that, hey, just because this particular carrier is the same one, or this insurance company or policy is the same one that not the same one that my colleague got, doesn't mean that that's bad, right? So there are specific solutions for your unique situation.
Right,
we can find that for you.
Because agreed, that can be confusing. And especially as a female physician, it's not uncommon that we'll talk to male colleagues and, there are wildly different quotes. Okay, well, there's actually, again, there's a lot of data. I know we're not jumping into that today, but I know that the data kind of helps explain the background for that and the reason why these processes are in place. And so, my last point that I wanted to ask you about, and this goes back to all of us, I think, having the responsibility of taking agency over our own lives and our own wellness in every area of life. So, the way that I see it, it's nobody else's job to help me as a physician get disability insurance coverage, and especially as a surgeon where I need own occupation DI. Like, it is, at the end of the day, nobody else's job. If I had graduated from residency without it, like, that wouldn't really be anyone's fault. You know what I mean? Like, your program director, your mentors, even like your senior residents, like, well, that's not them. They don't like get your auto insurance either, So we do need to kind of grab the bull by the horns in that regard. And of course, the longer that we wait to do it, the kind of increased risk that we're accepting on our end. Like, hey, something totally unforeseen might happen in your senior years of residency, either to your physical health, maybe to an immediate family member, leading to, significant grief. I mean, anything could happen, of course. And so when do you typically recommend looking at DI?
Yeah. Honestly, the earlier the better. Waiting till residency is okay. You can get a policy while you're in med school. That's possible. But I would say once you hit residency, let's get serious about it. And there's, we have different strategies we can employ to keep costs low because it's not an inexpensive proposition, right? I get that. But it is important. And there's strategies we can use to get your foot in the door, essentially, with a policy. And enables you to increase that amount that you get paid as your income goes up over time without medical underwriting in the future. So that's the real big thing is like when you're young, you're never going to be younger, right? You're never going to be younger than you are today. And likely you're not going to be ever as healthy as you are today as well. So, and there's so many unforeseen circumstances, that can come up, whether it's a physical thing like cancer or some other disease that comes up, or you have something external. You were just sharing about a friend earlier today, and you just mentioned it briefly here, like you have, somebody pass away that you're close to, and that has a bigger impact on you from a mental health perspective than you originally thought. And it's like, you weren't ever planning on that. You got a good bill of health. You don't have any family history of that. And all of a sudden it becomes a thing. So you don't know when these things are going to happen. And, you don't ever want to sound like doom and gloom and something is going to happen. But statistically, a large number, like 1 in 4 doctors will become long-term disabled. And a lot of people are like, well, I'm probably not that 1 in 4. But 1 in 4 is a pretty big number. I mean, when you come down to some statistical viewpoint on that. And so, earlier the better. And just get it taken care of because there are so many things that can go wrong, unfortunately. And so, that's my suggestion.
And there are specific discounts for residents. Is that correct?
Yeah, hands down. Yeah, from a pricing standpoint.
Yeah.
You can certainly, if you're in your residency program, more than likely there is a discount available to you. And so definitely look into that. Pattern, because we work nationwide with a ton of doctors. I don't know of the last time that we ran into an institution that we didn't have a discount for. So we can help there as well. The money part of it is a real big part of the whole process here. Because again, it's not inexpensive, but it's super valuable. And so as a surgeon, like if something happens, how critical it is that you have that coverage on you. And what people don't recognize when it comes to cost, for example, is that, if you go on claim for 1 or 2 months, like you've made up for years worth of money that you paid into the policy like that. So it's a big value proposition.
Absolutely. And I feel like from my own experience, I started searching by the end of my PGY3, third year of residency, because I did a 5-year, surgical residency. And then I signed the dotted line like early 4th year.
Yeah.
But that's also because I am not a last minute, like under the wire type of person. I know that there are people who wait until like right before graduation and then they kind of submit for quotes, things like that. I think that what a lot of us tend to underestimate, though, is how long it can take to go from submitting the quote to signing and cementing an offer.
Right.
Like that could be just months long.
Yeah.
Right.
Yeah.
And so I definitely, I'm always a proponent of like doing things early, doing things in a timely fashion. But this is one of those areas where I encourage people to be on top of it.
Right.
And not be that person who you're graduating residency. This is like one of the most exciting times in your life. And then you're like, oh, this like my medical records still haven't gone through for that thing, like it's
Right.
pending. Will I still get the discount? Will I still,
Yeah,
have that
exactly.
be honored and everything?
Yeah. Well, and I did want to share too, like, obviously we see what happens at the carrier level, but, part of what we bring value to is the doctor's experience as they're going through the process, right? And so because we've seen how carriers respond to different things, like we can help guide on and give tips to the physician as we're going through this process. Here's what you should say, and here's what you shouldn't say. Like, answer all the questions as honestly as possible would be my first tip, if you will. If there's something that's touchy, be honest about it. Don't answer any question they're not asking. But
Right.
always be fully honest with everything that they're asking for, because eventually, number one, it's going to come out. And if for some reason it doesn't come out, and you go on claim later, and they find out that you withheld information, especially intentionally, there's going to be a problem, right? So you want to be as forthright as possible. It's in everybody's best interest to do that. Another tip that we see, it actually comes up way more frequently than maybe you'd expect. Or maybe not, but we see a lot of doctors who, they'll go into the underwriting process, and the underwriter will reach out to us and they'll be like, hey, there's this issue that came up in the medical records, and we'll tell the doctor that we're working with, we're like, hey, they said that you had this particular item in your medical record, and the doctor will be like, wait, what? Like, I've never been diagnosed with
Right.
this thing. But in the record, it's either there's a code that's sitting there that's, sounding an alarm, or there's a statement that was made by a physician that is really causing some concern and throwing up red flags for the insurance company. And so having a good understanding about what is actually in your medical records before you go into the underwriting process is pretty potent. If you get into the process of underwriting and then we're finding these things out, like it's not the end of the world. We've had that happen on a regular basis. And if we can communicate to the insurance underwriter, what is actually happening here, we may have to go back to your attending physician and say, hey, can you write me a letter and explain why you said this statement in here? But if you can come in with records to begin with that are understood by you, and there's not going to be any sort of gotchas that are hidden in there, that's pretty potent as well. So those are just a couple tips that when it comes to advising and trying to give doctors the most valuable and helpful experience as they go through this process, because it's not the most simple coverage to get, but we want to make it as easy and fast as possible.
Yes, which is definitely, I think speaking our language. Like, as a doctor coming to this process that, realistically, most of us know very little about, it's a little bit of a black box.
Yeah.
Honestly, I was on board with some of it staying a black box. I was like, I very much believe in working with an expert and a guide.
Yeah.
As long as I trust them and we communicate well, that's really the way that I want to, make these major financial decisions or like go under these contracts. And so what's nice about working with the broker as opposed to going directly to the carrier, which I know a lot of physicians who have done that, it's nice to feel like, okay, you guys will do the shopping around for us at the 5, major carriers. And then not only that, but as you've alluded to, there could be road bumps along the way. So you've mentioned that up to 21% of your physicians who do, submit for quotes, they get quoted with mental health exclusions, which that is a higher number than I think a lot of us, because this goes back to where's that 21%? Because I think 100% of the thousands of people I've talked to would be like, no, I'm killing it. Like, I'm doing really good.
Right.
That 21% has to be coming from somewhere.
Right.
But what's nice is that if something like that exclusion arises, if people have like reconsiderations that end up like on their policy, having, again, that trusted expert on the pattern team who they have a great relationship with, they're easy to communicate with, and you just go through that person, I think that is worth a huge amount of time and money.
Yeah, I appreciate you saying that. And to your point, and kind of bringing it full circle to the mental health discussion, like, yeah, you're right. 21% of the doctors that we worked with this last year had some sort of mental health exclusion on their policy, which isn't a small number, right?
No.
And in fact, that's actually growing, and there's probably a variety of reasons why that is, of course, and some that we've touched on. But again, working with somebody like Pattern to help walk you through this process, we'll help you get a policy. That's really the easy part, but it's what happens after this, you mentioned this whole idea of a reconsideration period. That's kind of an insurance jargon. So let's say you do get a mental health exclusion on your policy. If that happens, it doesn't mean it's the end of the world. It doesn't mean you can never, ever have coverage for mental health again. It might mean that, but it might not. And so a lot of times these insurance companies, for a lot of different exclusions, whether it's a physical thing or a mental health thing, they will put on this period of time where they say, come back and talk to us in 2 years, and we'll take a look back at the history that you've had. If things have either improved or we've now witnessed some stability in that condition, then we can reevaluate our decision. And we've seen carriers, insurance companies, remove these exclusions and give more coverage, essentially, right, to the doctor. And so it doesn't stop once the policy is sold. Our help and our service and our guidance, it goes throughout the entire life of the policy that you have it with us. And we want to be that advocate. Like we love doctors. We see the amount of impact that they have in their communities with their patients, and we certainly want to be a resource for them and provide real value that's practical life value. So
I love that. No, that's a huge service, and I really don't think can be overstated.
Yeah, appreciate that. Well, cool. Yeah, it was great to have this conversation with you, and we'll be seeing a lot more of Dr. Hardin in the future, being our physician liaison, so stay tuned for more.